Dear colleagues, my name is Merola and I am a gastroenterologist at Sant'Angela Hospital, that's the second medical school of Sapienza University of Rome. Actually, I'm attending there my PhD in digestive oncology and my field of research is digestive neuroendocrine tumors. The study was inspired by the observation that in many patients affected by this disease, metastases are present since time of diagnosis. This can happen because in these patients a clinical syndrome was absent, so they have been diagnosed occasionally during diagnostic exam prescribed for other reasons. However, TNM staging system classified all these metastatic patients as stage 4, no matter what the site and number of lesions at diagnosis. Thus, we aim the study to analyze if their survival could be somehow affected by a different extent of disease at the time of diagnosis. 3 different University of Italy were involved in the study. I mean, Sapienza University of Rome, the second medical school in particular, University of Verona, University of Bologna, and all patients included have been seen in one of these 3 centers between 1995 and 2009. We included all patients having a digestive neuroendocrine tumors with a primary site in the pancreas or small bowel and being stage 4 at diagnosis. It means having metastasis since time of diagnosis. We excluded all patients being stage 1, 2 or 3 at diagnosis and all patients having a genetic clinical syndrome such as MEN1. What we observed in the study was that a difference in survival was significant in patients at a primary site in the pancreas or a primary site in the small bowel, confirming that already present in literature that pancreatic endocrine tumors have a worse outcome than small bowel one. We proposed a subclassification of the stage 4, dividing patients according to the different metastatic status in 3 groups. We included in group 1 patients having just hepatic lesions but with a minor involvement of the liver. In group 2, we included patients only with hepatic lesions but with a major involvement of the liver. In the group 3, we included all patients having already at time of diagnosis extra-abdominal metastases. And we saw a significant difference in survival according to the 3 different groups, because group 1 has a 5-year survival rate of about 80%, group 2 of about 50%, group 3 of just 12.8%. We also performed a risk factors of analysis for poor outcome with Cox-Hazell regression model. And we saw that significant risk factors for poor outcome were Ki67, that's a replicative index for neuroendocrine tumors in general, the presence of a pancreatic primary site, the size of the primary site, and the presence at diagnosis of extra-abdominal metastases. And multivariate analysis significance were kept by Ki67 and extra-abdominal metastases. So we can conclude that Ki67 and extra-abdominal metastases are significant risk factors for these patients, and we can propose a subclassification of stage 4 patients in 2 groups. Group 1, stage 4A, patients with just an abdominal metastatic involvement at diagnosis. The second group is stage 4B, patients having a diagnosis extra-abdominal lesions. The latter are in fact patients worthy of major attention, more aggressive therapies, and probably with a worse outcome. Thank you for your attention.